the patient came in with. Yes.
Okay.
Let me give you an easier
Yeah.
example.
Okay.
Let's say somebody wants to curl 40 pounds. Cannot curl 40 pounds. He's hurt his biceps. He cannot curl 40 pounds. He comes to you. We go through the process. We have the muscle tests. We do the correction. We treat the neck. The bicep tests are competent. We can get an isometric, but the patient cannot lift 40 pounds yet.
Right.
So now I have to strengthen the bicep to do the bicep curl at 40 pounds and up. There's no DNS movement in itself that has a bicep curl. Yes.
Well, I mean, now this is where I tell the patient, what the hell do you want to curl a 40-pound bicep for?
Just crawl on the floor and let bygones be bygones.
Just roll and crawl.
Yeah, that's right. You're overambitious for your species. So
some people may want to curl 40 pounds. So
yeah. So there is no there's no particular DNS movement with a bicep curl attached to it, not in the planned movement patterns, not in anything. So we therefore have to isolate the biceps, but yet integrate it within the postural system and make it the agonist in the 40-pound curl and start off with 20 or 15 or 10 pounds and work our way up. So I may have a gait stance posture, standing posture with the contralateral leg forward. And I'm observing the rule of flexors in action contralaterally and so on. Or it may be that he needs to do this and he needs to do it in, let's say he has to carry these 40 pounds and then he needs a cross-body throw. So I might do an ipsilateral position with the 40 pounds, starting the movement and then continue it into a transverse diagonal motion or whatever. But that's what I mean. So if you have mastery then of the DNS global movement pattern, then you may integrate what looks like a purely orthopedic exercise into the DNS pattern. And you can therefore strengthen the biceps in integrated isolation so that it can be loaded to the point where it becomes competent and the ADL failure is abolished. But so we must go between all these things. How do I test the bicep beyond the isometric muscle test of competence, of neurophysiological competence? That's one test. It passes that. But it fails the ADL functional test of 40-pound bicep curl. And then I have to find an exercise that observes the rules of the global movement pattern, but incorporates and integrates the biceps, but isolates it in a way that it will perform the function I'm interested in. So this brings about a rather complex mindset because you are going to try to either you can ignore the DNS and just give him the biceps curl in any position you like, or you're going to use the integration of the chains, the posture, all what we aspire to as being protective and improving the longevity of the entity during this exercise and the acquisition of the ADL function that has failed or has yet to be acquired.
Yeah, that immediately reminds me of a couple things. First of all, I take offense to the fact that you say there's no DNS position that'll do a bicep curl because, yeah, half jokingly, because my brain immediately went to Well, in walk, I can use a walking pattern or a staggered pattern in standing and utilize a use the bicep curl within that pattern, and that's
Yes,
of course what you immediately went to. I understand what you're saying. There's no immediate, if you look up at the DNS posters, nothing is very immediate to say, "Oh yes, that's a bicep curl there."
that's
But
right.
when you use the phrase, when you start to master um, development and the understanding of the planned movement patterns, then you can start to integrate these more artificial, isolated things like a bicep curl into these patterns.
Mhm.
And that brings me to the next thing, which I've heard you say a couple more frequently over the past year, which is um, like part of the quality of the DNS model and moving like this is that moving like this constantly recentrates your body for you. I think that's the word you use,
Yes,
recentrate.
yes, it's a
Uh,
reset. Yeah.
it's a reset. It's a global. That's right, global
Hmm.
reset. That you know all whether you're prolonged sitting throughout the day, whether you're repetitively having to do a particular movement that is screwing you up throughout the day,
Hmm.
for lack of a better term. If you go back to these basic planned movement patterns and execute them well, if you're not too screwed up, they should be able to globally reset you and
Hmm.
unscrew you up from your day
Hmm.
from your daily living.
That's right.
I like that. I mean, it's just it's a very, first of all, I think it's true.
Hmm. Hmm.
It has the nice thing that I think is actually true.
Hmm.
Um, but it's also a nice way. It's a metaphor. It's a nice metaphor to think about how this works and the perspective of how DNS and the developmental plan movement patterns are useful. And that leads into the idea of I can, with my patients, and I probably said it at seminars, said, if you want to do a bicep curl, you can stand in front of the mirror, text in one hand, and do your bicep curl. And now it's a useless bicep curl exercise. Or I show them you can stagger your stance. You can put a hand into your side, facilitate the brace and the breath like we talked about, keep that long, tall neck, broad, wide shoulder. And now, as you're doing your bicep curl, you're paying attention to the breath, you're paying attention to the posture. And now that is a whole body global reset
Hmm.
exercise. It's not a artificial, useless bicep curl
Hmm.
anymore.
Hmm.
And that principle can just be applied to anything you want to apply it to, really.
Absolutely, absolutely. And and that is why I think it's so important that the planned movement pattern really gets stressed in the courses, because if sometimes I will ask people, I go, okay, who's done it? This is a course B or exercise 2, and who knows the movement pattern, or did you see it? And they go, no, we didn't do it, or yeah, they are not using it. And I go, well, here's your chance. You really have to learn it. Um, it is uh, it is the key to exercise freedom if you know it, and otherwise you are enslaved by only the positions you know, only what you have been taught, and you will have problems with the transitions from these positions. Positions are great, but that's not the way we live. We live in transition from position to position. So if you do not know how the transitions come about and what looks like a faulty transition or a skip in sequencing, then it becomes very difficult to correct the patient because you've never even done it yourself.
Oh,
So,
yeah.
how are you going to do it? And
I mean that's just the same. That's the one of the things about DNS that people come away from DNS thinking, "Oh yeah, I got it. It's those baby positions right there. I've got them.
that's
I know how
right.
to do it." And we always use the analogy. It's you have a bunch of vocab words, but you've never put them into a sentence. You've
Hmm.
never put them them into a paragraph. You've never written an essay with them. You just know 6 vocab words. Obviously, there's not much utility in that, although you can get away with a lot.
You can, luckily.
Yeah, luckily you can.
But yes, but in order to be facile and to be able to experiment and move forward in clinical expertise, I think it is important that the global movement pattern is not only taught, but its variations, its variants are then emphasized so that people can see how this goes. Which brings me to another question, which is, we discuss very much, for example, the
If you
turning
enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.